Good morning and Assalamu alaikum. You are tuned into Inspire FM 105.1 FM. It is a Friday, 23rd of January, and the time has now just gone 10 o'clock. Welcome to Mother's Planet, a show where there is always something to talk about in a productive and beneficial way. I am your host, Neelum, and joining me in the studio this morning, my very jam-packed studio, are my lovely guests, Dr. Shobha, Singh, Lattimer, and Jutsna. So I'm going to make sure I'm getting everyone's mics on so that you can all be heard. Morning, ladies.
Good morning.
And how are you all?
Very well indeed.
Good. I will formally get you to introduce yourselves a little later to the show, but how's the week been?
I think the week's been good. Yes, very good.
Did you have a productive week?
Yeah, we've been out in the community, like with people in Luton, talking to Luton. Yeah.
Good. Nice.
Yeah.
So the weather didn't hold you back?
No, the weather's miserable, isn't it? But you have to get on, don't you?
Absolutely. I have to say, I don't like the rain. I just have to put it out there. The rain it sets me back, and with the rain, you get this dark gloom, and it's just not nice.
No.
I can't see beyond the gloom, and I think it's always causing havoc on the roads. You know, there's always traffic. School runs are always always late, or getting stuck in traffic. But the one thing I hate about the rain is I can't hold an umbrella. I can't hold an umbrella straight because the wind gets to me, and it's just too much thinking. So I will just put my hood on or let myself get wet. I'm not very good with umbrellas. Are you any good with umbrellas?
No, not if it is windy anyway.
Yeah.
It just blows inside out.
Yeah, it blows inside out.
How about you just now?
Can I just add, this is the third time being on Neelum's show, and every time I come on your show, it rains. And can I just say, it's the mindset. So growing up, I used to hate the rain, but now I don't. It's like, I didn't know, with the rain, that's when your answers are, your prayers are answered. And with every raindrop, an angel falls.
Yes.
And so I try to flip it around. So I try not to hate any weather. I try not to hate anyone or anything. It's the mindset. It's true.
And I know that.
And it's Jummah.
Yes, we should be actually quite blessed that we had the rain, because, if it was the opposite, where it was everything, we wouldn't be happy.
Exactly.
But I have to add, I just want to give a huge shout out to those mums who can push a buggy and hold an umbrella.
Yes.
Heroes.
Kudos to them.
Incredible how they do it.
I see these mums and I think, how that's a skill. That's a skill in itself. So listeners, we are live on air, reaching out to all our listeners through the airwaves at Inspire FM 105.1 FM. We are also streaming live on Facebook, where you must give the show a thumbs up and can also comment on today's topic. And as always, I am taking in WhatsApp or text messages on the studio number 07779 481 822. So any questions that you have for my guests, or anything around the topic, or even if it's just to tell me whether you've mastered the skill of holding an umbrella, do message in. Now, in today's show, my guest and I will be discussing the importance of research in health, and more about health awareness as well, and the importance in understanding our health, which I think is quite a pertinent topic. But before, ladies, I delve into my questions and quiz you around today's topic, can I get you to introduce yourselves to the listeners? Now, I have no preference. All I ask is that you just come a little bit closer to the mic so the listeners can hear you. I don't mind. Pat, shall we start with you?
Oh, hello. Good morning. My name is Pat Lattimer. Mm-hmm. I'm the CEO of Healthwatch Luton. Mm-hmm. I'm not sure if you've heard about Healthwatch Luton.
So we'll go into that.
We work for Luton, for the residents of Luton. We are the voice of the people of Luton. So you tell us your views. We listen. We share them views. We like good feedback. Mm-hmm. You tell us about good feedback, and we will sing your praises everywhere. You tell us about bad feedback, and we'll look at that and we'll take it to the people who need to know it. Mm. So we're funded by Luton Borough Council through central government. Mm-hmm. We can take that feedback to Luton Borough Council, to the NHS, to the ICB. We we are here for the people of Luton, and you can contact us in many ways and see us at events across Luton.
So, I mean, tell me a little bit about the Healthwatch, because when I saw your name as a guest coming on the show, I was baffled. I thought, Healthwatch, I've not heard of that. I mean, I'm not a Luton-born resident. I have come from outside of town, so I always think I'm out of touch with a lot of things and not aware of what's going on. So, how long have you been running, and why was this Healthwatch
So
created?
every council has a Healthwatch.
Okay.
And we are Healthwatch Luton. We have been around for 13 years.
Wow.
Before Healthwatch, it was Link,
Okay.
and we took over. We just listen to people's views and feed it back. We do quite a bit more than that. We sit on lots of boards like the Health and Wellbeing Board, the Scrutiny Board, Primary Care. We sit on a lot of meetings discussing what people think about care. We work with the local GPs and primary care networks around health promotion and support what activities they do for health promotion. We sometimes get projects from the ICB, the Integrated Care Board, who manage the NHS, to do work in Luton. We've done diabetes work and end-of-life care. And we sometimes we do focus groups. Sometimes we stand in the park at a fete, go to a GP function. At the moment, we're doing Interim View, where we go into care homes and we talk to the people in care homes and say, what is it like in this care home? We talk to the residents, the relatives, the staff, and then we feed back to the care home, and we feed that back to Luton Borough Council.
And so it's particularly focusing on the health, as in people's health or how things are run.
And social care as well. So, how things are run, what people's experiences are like. That's why it's good to have good feedback as well. Because if there is a good service, we would like to share that, because there should be more of that and less of the not so good services, shouldn't they?
But it gives you a benchmark as well. Once you've had that praise, then you know that, okay, this is the standard that everyone appreciates. So let's try and get everyone up to that standard. So it gives you a benchmark of
That's right.
where to work at. So I think it's quite good. And how do people contact you? How do people find out a bit more about Healthwatch?
So we have our website, Healthwatch Luton website. We get lots of feedback on our website. So you can go into our website and leave a comment about a service. There's like a short questionnaire you can fill in and say what the service is like.
Okay.
You can ring our number. We have a phone number, and you can ring our number. And we are at lots of events. We're out every day of the week in the community, at community centres, places of religion, in the summer when the sun's shining, and lots of events. Or even in the mall sometimes. We have a table in the mall and people stop and talk to us as they go by.
Okay, lovely. Thank you for that. And what a lovely intro as well. Welcome to the show, Pat. So Dr. Shobha Singh, please introduce yourself. I'm intrigued to hear about your L&D research champion. I know you're looking at Jutsna like, why did she put that down? But it's, something to be proud about.
Good morning, everyone. I don't have such a long thing to talk about myself in my introduction. Because the reason I'm here today is because I'm a volunteer. As you can see, I'm a volunteer. And as you can see, I'm an old age pensioner.
I didn't see that part. Just to let you know, I didn't see that part.
So my main involvement is as a volunteer. So I've been, I used to do international volunteering for more than 20 years. So since I stopped that, since I don't go abroad since the last couple of years, and I've recently moved to Luton, I decided that I would like to get involved locally, again doing volunteering. So therefore, then I got in touch with L&D, and of course, I'm there as a research champion, and also I do some work in the chaplaincy as a ward visitor. So these two hats I wear as a part of my L&D volunteering. But apart from that, I do Keach Hospice volunteering as well.
Amazing.
Yeah. So there I do some work as a compassionate neighbor. So, you're sort of paired with a community member and you go and talk to them and try to, help them in whatever they want. So I do that as well. And so most of my work so far is in a volunteer capacity. So this research, as a research volunteer, I don't know whether I need to talk to you about this particular event, how it all started.
Yeah, we will get to that. Yes,
Yeah.
I would like to know a bit about that. Yes.
So do you want me to do that
Well,
now?
yeah, of course. Yes.
Right. So what happened was, as a research volunteer, I work very closely with the research team in L&D Hospital. So sometimes, I go, they have the little stalls where they're trying to, like the International Research Day, they will have a little stall and they will try to attract people by showing them how research is done in a very basic level, how randomization is done and how do we do. So we do those kind of things, which is quite interesting. So that is how I got introduced within the L&D team. And then what happened was, then there is this National Institute of Health Research.
Okay.
That is NIHR. So there are different NIHRs in the country.
Okay.
So this part is the East of England Regional Research Delivery Network.
Okay.
So it is the East
Quite a
of
mouthful.
England. Yes, that's why I had to write it. So then, as part of that, they had a innovation grant scheme. So that in that scheme, the innovation grant scheme is given to PPIE, which basically it is patient, public, innovation and engagement, involvement and engagement. Okay. So that PPIE, so NHIR gives this money to PPIE and tells PPIE, we want you to write a proposal. We have this much money, funding. So you have to send a proposal which should be such that we are happy to fund that project.
Right.
So in trying to get a project together, then I was working with the team again. And then, of course, having worked with the equality PCN, I had some idea how the system worked and what needs are there. Because I was not just, it was not just sitting in an office. I was there in the community.
Yeah.
So I could see what was happening there and how best to use this money to bridge these two, the research and the community. So then I explained to them, probably might be a good idea for us to look into a project where we can look at how research can enhance the life of people,
in the community,
the disadvantaged people, looking at equality, diversity, inclusion. So all those factors. So how we can include that and put in a proposal. So then that sort of, was what I said. And then they were very happy to look into it. So because the equality PCN, I was so close to them. So I knew I would be able to do something with this. So then the ball started rolling and then they put in a proposal very nicely. I mean, I was not involved in that at all. So they did all the write-up and of course we got the grant.
Wow. Okay.
So now we got the grant. So the grant is it's a total of £3,000, which is divided between L&D Hospital and Bedford.
Okay.
So we have £1,500 grant. So that is where we are, and that is how it all started. And that, as a result of that, we are having this event on the 14th of February.
Okay. Lovely date.
Yeah.
A lovely date. Lovely
don't do
date.
this.
Yes.
So anything?
Oh,
no, not really.
No, it's a lovely date.
Yeah, so that's my introduction to this research.
Well, thank you so much. And you know, a lot of people will tune in today and think, oh, you know, it's lovely that you gave a background as to how it was all stemmed, and you know, we now have a firmer understanding of, okay, this is it. So just know you're very quiet there, and that's not usual. So I'd like you to introduce yourself, please, because you're not new to my show. I have had the lovely Jutsna on my show before, but I'm pretty sure there's listeners tuned in this morning that don't know much about you. So how does Equality PCN work, and how does your role fit in with that?
Before I start, can I just say we need another day just for Dr. Shobha Singh to introduce and talk about all the other hats that she wears.
Yeah,
so that's just for another day. I
Imagine.
think we might have to book her in quite a few sessions just for her to talk about all the other hats that she wears. Okay, Doctor, you're not just a volunteer. Okay. Thank you for having me, and it's lovely to be back. My name is Jutsna Khan. I'm a health and wellbeing coach for Equality Primary Care Network. We are proud to collaborate with 5 GP practices. So we cover 3 in Stopsley, 1 at the Biscuit practice, and the Link, and then a new practice that joined us, the Butte House, which has made us one of the biggest PCN in Luton.
Wow.
We're one of the newest, now one of the leading PCNs. We are proud to, so we are also co-founders of the Biscuit Peace and Wellbeing Hub, and which plays a key role in how we engage with our community. And Equality PCN is really about partnership, trust, and making healthcare more accessible, inclusive for everyone. Hence why the relationship that we have with our partners is very important. It's like who we collaborate, who we work with. It has to align with our vision, our ethos, and that's what equality is all about.
Absolutely. Thank you so much, Jutsna, and you know, welcome to the show. So I guess Dr. Sowa, you briefly touched on the gap that you saw in the community. I would like to know what the Research Health Awareness Fair is. I think a lot of, I might be saying it wrong, so is it Research Health Fair? That's correct.
Right.
So
Yes.
it's the Research Health Fair. Can you tell us a bit more about this, what it is, and you know, what gap did you see in the community that you thought that this would be something that would be feasible and beneficial to the purpose of your project?
First of all, research. What is the importance of research? We need to know that. So research is quite fundamental to human advancement. So it sort of moves us from just mere guesswork to actual understanding of how to tackle challenges, empowering us and creating us and helping us for a better future by having that evidence-based understanding. Because it is very easy to have guesswork and assumptions, but until and unless we have a scientific base to it, it doesn't work. So research is quite important. But what I observed when I was working with the community, even in the Hindu community, as well as the Muslim community that I was involved in along with Jutsna, that people had this notion about research that it is something to stay away from. So research is not a part of them. It's the same thing I observed even in the hospital. So people didn't want to engage in research because they think, oh, where is the data going? What is going to happen? How much are people going to know about me? So those kind of assumptions people had. So I thought if we can give more information about research to sort of clear the myth about research, make it more open, and make it very simple so that people understand it. And how can they understand? By getting them involved.
Yes.
So that they are the people who are making decisions. So it sort of becomes a more collaborative kind of thing. So they do have a voice. So if they say, oh, this is what I want to do and this is how I would like to do, what do you think? And so both the research people as well as the public or the patient or whoever, they are able to make that kind of connection. So whether it is in the start where what questions needs to be answered, how the research design need to be done, what are the things we are looking at, and how are we going to disseminate the information. So these things are all important because people there outside, apart from the people in the hospital or people who are working in the field, the rest of the community are not aware of what is happening. And the second thing that I noticed was most of the research that is done are on Caucasian, white people. So some of the results, when we use, like, for example, medicines, when we use them on people from other ethnic background, how effective they are.
Yeah, you have no idea. Yeah.
See, that's a big thing. So
it's a big thing because blood pressure medication doesn't work so well on some ethnic groups as other ethnic groups. And so it's very good that if people from all different ethnic groups participate in the research and share their experiences, then you can alter the medication or use different medication for different groups, for different ethnic groups.
Exactly. So that is lacking, you see. And Luton is we have such a diverse community. And it's so good if you are able to tap into them and to be able to use, involve them, try to encourage them, try to empower them to take part. And that can only happen if we take this fear element away.
Yes, absolutely. I mean, I'm going to give myself an example. We will walk past in the town centre. If someone walks up to me with a clipboard, I won't stop to help. But it's because we've been bogged down with so much technology that be careful what information you give.
Yes.
Be careful what you part from. That people are very caved in. And the other thing about the South Asian community, coming from a South Asian community myself, is we're very private. We don't like people to know that we have a condition or we have an illness, or we will strive through it ourselves.
Yes.
We will soldier through pain. We will take whatever we need to take, but we will not talk about it. And I think we're moving away from that a little bit now as my generation is growing up. And we've realised, I look back and I think, I was telling Jutsna, my mum going through menopause, for example, how she coped with it. If I'd known or if I was educated, I could have supported her.
Yes.
And, now I know everything that she was going through makes sense to me. There was days that she would just cry. There was days she would have, a scarf wrapped around her head and just say, I don't need the light and I can't sit down and talk to anyone. But I just thought she's busy, she's tired. We never actually sat down and thought, what's going on here? And so things like research would have educated people like myself. We wouldn't have been in denial about this is a process, and there's things that have consequences to these illnesses or conditions, or there's symptoms, and if we're aware of them, then we can manage them better. And I could have been quite supportive. I phone up my mum every now and then, say, Mum, I'm so sorry, I didn't understand, but I think I'm going through it now. And I understand what you were going through. So I think it's important that we don't feel so caved in about ourselves, and the more we give in terms of around health, then it will educate the generation to come, and we will know what's working and what's not. So I think it's trying to take that element of fear of this is my information and this is personal to me away.
That's right.
I think women's health has been very much kept secret for many years and sort of belittled, really, isn't it?
Underrated, absolutely.
And if a woman's got a problem, you're making too much of it, really, aren't you? And women don't discuss their health, do
Yeah.
Yeah.
You know, my mum would never have discussed anything like that. It was private stuff.
Yeah.
But I think we are in a world now where
Yeah.
people are saying, actually, women's health is important.
Yeah.
We've got to stop sweeping this under the carpet, haven't we?
Absolutely, yeah.
And maybe your mum will be support to you now.
Yes, I know, because she knows what's happened now. Ladies, you won't believe this, but we've actually come to the first half of the show, so we're going to go over to a short commercial break, and I think the listeners will be keen to know a little bit more about the health fair after what to expect and what's going to be carried out in this, and how your roles will be playing a part in this as well. So, listeners, if you have just tuned in, where have you been? I have the lovely ladies with me this morning, and we are talking about the health fair. So if you do have any questions around today's topic, or just want to share some comments around health and research, do message in on WhatsApp or text message on the studio number 07779 481 822. But for now, we are going over to a short commercial break. So use this opportunity to refill your brew and join us after a break. Assalamu alaikum.
This program will continue after the break. Continue listening to Inspire FM. Inspire FM.
Inspire 105.1 FM.
Radio for the community, by the community.
Tops Pizza deliver the top pizzas in Luton. For a start, all the toppings are 100% halal, and Tops use fresh dough every day. Then there's the cheese, the highest quality available. And when it comes to food preparation, cleanliness is taken as part of our faith. So that just leaves the taste, choice, and great offers, including buy one, get one free on all medium, large, and extra large pizzas. Tops Pizzas, Wellington Street, LU1 5AA. Order online, topspizza.com, or via Just Eat. Download our app or call 01582 72 5000.
Legrave Heating Supplies. With over 20 years of experience, we're the largest independent plumbers merchant in the area, specialising in all types of plumbing and heating, as well as combination boilers and megaflow cylinders. Whether you need a new bathroom or a complete new heating system, LHS is the place. Come along to our brand new bathroom showroom at Unit 1, 3 Chorlend Lane, Luton, to see the latest range of quality bathrooms. Or log on to legrave.net. We're an Interpart-approved stockist for all genuine spares. Our new store in Bedford is now also fully opened. Legrave Heating Supplies. Call Luton 84 86 88.
One of the most notable women who took part in the Battle of Uhud was Nusayba bint Ka'b. She stood firm with the Prophet, peace be upon him, acting as a human shield to protect him.
How likely is she to, have another heart attack?
Can I still go to the gym after heart surgery?
Is my mum still my mum if she has a new heart?
When it comes to heart health, no question is too big or small. That's why British Heart Foundation have dedicated cardiac nurses you can speak to by phone, email, or online chat.
Hi, this is Chloe from British Heart Foundation. How can I help?
Search BHF Questions.
Celebrate in style at the Grand Royale, Luton's premier banqueting hall, offering elegance, luxury and seamless event planning. Host up to 750 guests with top-tier catering, stunning decor, photography, videography, hair and makeup, DJ, dance floor and expert event management, all under one roof. Whether it's a wedding, birthday or corporate event, let's witness the happy family moments together. Call 01582 551913 or visit grandroyale.co.uk today.
ما في أنفسكم أو تخفوه يحاسبكم به الله.
Ali is one of those children who, with your assistance, has the honour of being a Hafiz. And that too from only £29 per month. Help UKIM by sponsoring a Hafiz and get rewarded by up to 70 times blessings. For donations, call now or visit ukim.org.
Assalamu alaikum wa rahmatullahi wa barakatuh. This is I Am Khalid. You are tuned into the Rise and Shine show with Tariq. Keep it locked.
Does your car sound like this on the school run? Want to change that? Then tune into the Rise and Shine show with Brother T. Sing along to awesome nasheeds, answer our puzzling riddles, and tell us what you think of our newest events. The Rise and Shine Show, every weekday from 7 a.m. to 9 a.m.
From the studios of Inspire FM, the time is now 10:30.
Good morning and Assalamu alaikum. Welcome to Mother's Planet. It's Friday, 23rd of January, and the time has now just gone 10:30. I'm your host, Neelum, and joining me in my studio this morning are my lovely guests, Dr. Shobha, Singh, Pat, Lattimer, and Jutsna Khan. Welcome back to the show, ladies. So, listeners, before we head over to what came as a very fast half, we were talking about the importance of research and how there's an event running on a very fantastic date, 14th of February on a Saturday at where's it being held again?
Biscuit, Peace and Wellbeing Hub.
There we go. And I think listeners would like to know a little bit more about what to expect at the health fair. So what is going to be there?
So what we've done, we've created a safe, friendly environment where language will be available, which makes a huge difference. And I'm sorry to say that I think Luton has become a event. We all are event fatigued. It's like there's events every other weekend. What makes it special about our event? So what we've done, yes, we had some funding, but we had to be very careful how we use it. So we've done everything ourselves. The bulk of the money is going towards the audience. So they'll get a lovely goodie bag, like water, personalised water bottles, bookmark. I think we're doing and a lunch. Obviously, lunch is always a bonus. And because it falls on Valentine's Day, it wasn't deliberate. It wasn't deliberately done, but it's just a date that it was as convenient for everybody. We will be giving out personalised love heart sweets as well. So it's just thinking about those little extra things and having it at the hub. We thought, it's just what a great way of introducing this to the community, bringing research to the community rather than community going into a clinical service not everybody's comfortable with. So that's the whole purpose of us
and the
doing
hub's
it.
quite centralised as well,
Yes.
where it's based, so it's easy to get to for the community as well. It's not like, oh, okay, I have to park or I have to think about how to get there. It's actually, for some people it's walkable, so it's quite local.
It does fall during February half term, so which is fine. Everyone's welcome. You could come with your family. That's not a problem as well. And the timing that we've done is from 11 till 3. So it doesn't eat up the whole Saturday. You don't have to stay there for the whole session. You could just stay there for part of the session and speak to the clinicians there as well. So that's the whole reason we chose that date.
So walk me through the event. So I'm coming and I'm walking through the doors. What am I going to see? What's going to be around? Because, as I mentioned earlier in the show, when you hear the word research, people think it's not going to be for me because I'm not going to part from any information about myself. I don't want to disclose information about myself. So, how is this event different from that? And, encourage me to come. How would I feel that actually this is not what I'm expecting? You're not going to be taking my data and doing something with it.
Well, Healthwatch Luton, we've been involved for a number of years in research on diabetes, and we've worked closely with Diabetes UK. We have lots of information on managing diabetes, and we encourage you to, join a register of people that participate in diabetes research. Lots of people from the Asian community do have diabetes, and we have REN champions who are people from the community who are trained in diabetes, who go out and talk to people about diabetes and how to manage it, and encouraging, as we said earlier, people from all ethnic groups to be part of research so that we can have your experiences and that will influence the treatment. We also, nothing to do with research whatsoever, but we've got loads of free toothbrushes and toothpaste to give away. We've got fun activities to do, like little jigsaws and puzzles and giant teeth that you can have a demonstration of how to brush your teeth correctly. And yeah, so come and get a free toothbrush and toothpaste.
I mean, I know this is a bit off topic, but it's around health. I a few months back now, I did have the oral healthcare team on the show with me, and I was surprised to learn that Luton has very bad oral healthcare. So having a dummy like that and having access to toothbrushes and being shown how to brush your teeth is actually a fantastic activity for not just the kids but the adults as well, because we think we're brushing correctly, but we may not be. So actually visualizing it like that is quite good to see. So that's
and tips for keeping your teeth healthy as well. So not just about brushing your teeth, but drinks, you know, drinks in bottles and things like that. So yeah, tips for keeping healthy oral care.
Absolutely. And I guess the key thing here is, you know, you mentioned about diabetes. So, you know, someone will come along and say, yep, I'm diabetic. And then that's, you know, them parting with some information about themselves. Where is this information going? And what information are you taking from people? Because, you know, as I said, people are so worried about parting from personal information. So is any of it personal?
Yes, we all have a bit of paranoia about about giving out our information. So on that day, we also have a little research stall where we will be engaging in a research experiment, which is a very basic kind of experiment where people can have some idea, oh, this is how research is done. So during that time, the people can get more information about where is this data going, how do I get involved, what happens, and what are the different researches that is going on. So all this information will be provided there, because people can no one is going to force them to take part in anything if they don't want to. Until and unless they consent, nothing is going to be done. The data, the personal data, will always be anonymous. Their name and the date of birth, or all those kind of very identifiable data, would be anonymized. So people don't have to worry about it. So when we are talking about all the other stalls, we just now will be saying, blood pressure check and various other things. What we are aiming to gain here is how research can help in prevention. So the preventative aspect is what we are focusing on. So, before you become diabetic, before you become high blood pressure. So what are the things that we can do to monitor it and to avoid it? So we are just connecting that research bit with this. So we are showing them, look, there can be screening, breast screening, prostate cancer screenings. So what is the reason for these things? What is the point in doing these things? So that we don't get affected by these things. So if we involve researchers in it, like if someone wants to, if there is a breast screening research going on, so what are they looking for? The reason some breast screening is now important is because some research has been done. So the earlier detection. So that has involved research. Otherwise, we wouldn't be. We are just making use of the final bit. So what the aim of that event is to show, to just make people aware that what we are doing here is as a result of researches that has been going on. So today, blood pressure check or diabetes, blood sugar check, it's all geared up to prevention. And that is because we have been engaging in research. And if people start engaging in that, then it is going to be beneficial for the individual, for the carers, for the society, for the community,
and the
as a
future
whole.
generation.
Yes.
Yes, absolutely. And I think, again, with research, the mass research that you have, the range of research that you have from different ethnicities will help that research. And when it comes to blood pressure, it's one of the silent killers, and not knowing is, dangerous. So, I mean, I've heard younger and younger people now, similar age to myself, have high blood pressure or, cholesterol issues. And
lifestyle problems.
And these things are detected early, then, as you said, we're looking to try and I think that's the push that we need to get through to the listeners and those people that are going to be attending the event, that the aim is that you want a better Luton, you want to actually have a healthier Luton, and this is going towards, the 2040 vision where we are trying to create that home that everyone is looking for, where we are fully aware of our health, we know how to handle it, and we have better research around it. So I think
and also accessibility to healthcare, because people don't do that. So how easy it is to access healthcare and to raise that awareness about that, there's no need to suffer in silence. Because there are communities, there are pockets in the community who don't access the care that is out there.
And I think there's a fear around that, because not knowing, ignorance is bliss, So not knowing, you think, I'm fine, I'll be fine. And then when you go and then you think, gosh, all that time I thought I was fine, I'm actually not fine. My blood pressure's not good, my sugar's not good. And then we have this anxiety build up, and then,
can end up in depression.
People can end up in depression. It can lead into a dark hole. So what's your advice around that? Encouraging people to not have that fear of I'm okay and I don't need to know.
So I think to attend, in order to avoid those kind of feelings, it's like this event, we're not physically going to be carrying out research on that day, is actually an awareness. So I think this opportunity was given. Thank you, Shobha, for planting this seed. And I know you keep on saying you haven't done anything. You planted that seed and bringing research out into the community. So this is our chance to prove that we can do it. And we need to demolish that saying hard to reach community. There are no such hard to reach community. We need to reach out to the community. So we've been giving this platform now. So it's our responsibility and all the listeners' responsibility to do this for a better future. And this is the only way we're going to do it. And going back on the day, what we're going to have, you could come and get your ears tested, free ears tested on that day. We're going to have parallel lives coming and talking about all the services that they do. Health is everything. It's no black and white. So you're coming through the door. You don't know what reason you're coming into the door, but you will be inspired. It's like, we're going to have all of our clinician teams there. You're going to have access to GP. I had the university contacting me yesterday, university CTOP team. They're like, oh, we want to come. What is this about? Bring it on. Come on. So it's like, it's not just us. Three of us will be there. Equality PCN, the whole PCN team will be there. The Biscuit Hub, part of the Biscuit Hub team, they will be there. Pat will be there. Come and get your ears tested alongside so many other brilliant, fantastic organizations. And the main purpose of this is to leave, is that we hope people leave feeling informed, valued and confident, knowing their voice matters and that research is something they can be part of, not something done to them. So we need to break that myth.
Yeah, and I think it's breaking that barrier, and that's very well put there, Jutsna. Thank you so much. And very recently, my daughters have come back from their school saying that they've been learning about CPR training at school, and they said they had a dummy and they had access to it, and they said the first point is to just check if they're breathing, and the tips that they were given just to check how a patient's breathing. Don't look for a pulse, don't run your fingers under their nose. If you can access a mirror or something, glass related, even the screen of your phone, and just put it under their nose and check. If it steams up, that means they're breathing. Call 999 and just get help straight away. And then if they're not breathing, how they perform CPR. And it's amazing. I thought, I wish I'd gone back. I need to go back to school because I wish I had this kind of training.
We will be doing CPR training.
I was just
That's something
ask.
that we do. We do CPR training. We do blood pressure checks. Neelum, we're everywhere. That is the whole reason. Is to break that cycle of people saying hard to reach, they are now hard to reach. And this is our opportunity to bring research. It goes back to data, collecting data. And I had to learn all these things. It's like doing this for the last God knows how many decades, but it's being around these individuals, my fellow colleagues, friends. I've learned so much, and this is just the beginning, and we've got so much to do, and we need to stop talking about it.
I think the CPR training sold it to me, because
perfect.
I think it's something that we should all be aware of how to do and what to do. You could save a life. So, and knowing that you've got that, and it could be, through a choking. CPR is needed in so many aspects. We just don't think. So, that
is a notion Dr. Mahmood had started. So we go out in the community and we deliver CPR. So we also work very closely with the feeder schools. So we go out into schools, and so this is part of it. CPR training as well. For children, and we make it fun for the children. We have medals to give to them, trophy to give to them, certificates. So we make it all fun, exciting. I don't know if our friend Spider-Man's going to come along. I usually have contacts with certain heroes
of the community.
So they normally pop along. So who knows? If you miss it, you miss out. You just don't know who's going to be in that room and what that one person can change.
And you said something about food being available. So I think that's a big seller to everyone. You don't have to cook. You can just come along and eat.
It's healthy. It will all be healthy and lunch
and delicious.
And delicious, and it's all made by love. And that's part of it. That's where most of the bulk of the money went, was the food and something to give back to every individual that's going to walk in through the door.
Lovely. And that's brilliant. And, I think it's a good way of encouraging everyone to come out when there's food involved, because everyone will come out when there's food. But, it's important. Research is important because we need to make that change. And, what's beyond research? What can we look forward to? I mean, are there plans for the future around this? Would it be around health, or are you going to stretch this a little bit further and look at other areas like education?
Education will be a part of it, or should be a part of it, because without education, it's not going to move forward. So we will wait for the data. I mean, how many people are going to fill the form at the end of the day, and we'll look at it and what have people asked us to do. So it'll depend on the feedback that we get from people on that day. And depending on that, we will try to see how best to plan our future events. So, and I'm sure at some point there has to be education. I mean, like we were talking about CPR. It's just like those simple things, but trying to find out what would be the best way forward.
I think there's lots of screening going on across Luton, isn't there? The PCNs, the GPs do lots of screening. And I think, screening is important, isn't it? I think lots of people, like you said earlier, are scared about going for this test or that test. And in some ethnic groups, uptake of screening is very low. So I think there needs to be more education on screening, what is involved in screening, so that when you go, you know what to expect. And how you'll be told the outcome, and sort of getting rid of some of that fear around screening and stuff. There's lots of health inequalities in Luton. Among different ethnic groups, among income and stuff in Luton, and I think that we need to reach out to them people and support them into coming for screening, participating in research, so that health services can learn more about people, and then treatment can change and be adapted to be personal.
And when we talked about accessibility, again, language can be such a big barrier. So if we can try to find those barriers, address those barriers, and then move
We've
forward.
had a message come through, so I just wanted to share this with you. Assalamu alaikum to everyone. Good promoting for an event. One extremely vital point, as an ex-researcher, ex-teacher and social worker with over 20 years experience, please ensure the events or promotions are done in the relevant languages. Majority South Asian community are Sylheti, Bengali, Punjabi, Urdu speakers. So if it's all done by English speakers, it'd be putting a lot of people off. So some people would feel embarrassed that they don't know how to say it if they can't read or understand the language. Including the posters and leaflets that are shared, if it's done in those languages, the majority speaking languages. And again, I guess research is needed for that as well, because we don't know what the spoken languages are out in the community. But I think the majority ones, Bengali, Punjabi and Urdu, are quite key ones to get out there. Thank you for that message.
Oh, that's amazing. Thank you for that. I just wanted to add to that is like, I've been working with equality for coming up to 4 years now, and research is something that we've taken on our 4th year. So we had to build that rapport with the community. It's like working in the community. It's like you have to listen to them, and you can't just throw something at them because it's alienated. So what we've done, we build that rapport, and it's like every workshop that we do at the hub or any of our other workplaces, we will speak to them on a one-to-one, make them aware, break it down, tell them what is available. And especially to all my ladies that come for exercise, it's like we've been doing it for 2 years, and this is really hard for them to bring a water bottle. It's not normal for them. So that's one of the reasons that I had to we're giving away water bottle, is to encourage certain communities how important it is for us to drink water. So we're still going back to basics. It's going back to basics, and that's something that we forget. It's really difficult. And another thing is like, this is all part of a big puzzle. It's like this is one of the little jigsaw puzzle, and I did not know Butte House, who has joined us, they're actually the only surgery in Luton that is research active practice. So we had our meeting yesterday. Dr. Ilango, he is actually part of research. So he will be there on the actual event. So we will be connecting all the connections together, the university, the hospital, the GP, the PCN, and the be part of research. If we all come together, we can achieve something big. And this is the only way we can make a difference. Not talking about it. It's just action time, and I think we're just done.
Connecting the dots.
And I think you
mentioned,
I think you mentioned earlier that there will be people there to help with the language. And I think that's the key thing.
Oh, of course. I'll be there. And we have all the languages. Our team are very diverse, and this is something...
and as a traveller, I'm pretty sure you picked up quite a lot of language in all your travels as well. So talk to me about the paperwork, things that people are filling out. Will this be in different languages, or we will be there?
We will be there in Bengali, Urdu, Hindi, Punjabi. We've got my colleague, she speaks Spanish. We have somebody that speaks a bit of French.
My daughter's a fluent French speaker, so
fluent French.
I could get her to come along if anyone wants to speak French. But we and I think,
Polish.
Yes, that's a key one.
Polish.
Yes. We have a Polish.
So we have that. Yes, we have a Polish speaker, and we do events all the time. I get told I do events in my sleep. So I think language is a must thing.
Yeah,
it's really, really important, and it's going back to basics.
And I think that message has highlighted the fact that actually you don't realise how much language can actually create that barrier of people feeling, I don't understand this and I don't know what's being said, so I'm just going to move away from this. So having that exposure to different languages and knowing that creates that comfort. You've broken that barrier already.
And we were the only PCN that participated with King's College London research 2 years ago, because they needed a cohort for South Asian community. And when people hear South Asian community, apparently they're hard to reach. And I'm like, no, they're not hard to reach. So I contacted her and I made it happen, because we had all the languages, all the staff from the surgery next door, the receptionists, the managers, they were all happy to come over to help us be part of that research, because we just don't understand how important this research is. It's like we're changing lives, and this is the only way moving forward. It can happen.
Yeah. So ladies, we've got a few minutes left of the show, just a couple of minutes. Anything to add about the event? And I think really what we want to start drilling in now is the date, the time and where. And any information, listeners, that isn't caught now, I will do my best to get that onto the Facebook part of the show. But go for it.
What would you like to say?
You can say it when it is again.
All right. So it is February the 14th on Valentine's Day. And
I don't think anyone will forget that now.
From 11 a.m. to 3 p.m.
St. Andrew's Church. Everyone's welcome. No booking. Just turn up as you are. Bring a friend. If anybody's interested in volunteering, come along. Anybody's interested in health, come along. So it's not just research. Don't let research put you off. It's like, come along and be inspired.
And
Absolutely.
Absolutely. And so you don't need to book. It's just a turn-up event.
Yes.
Yeah.
And
there'll be lots of representatives from across the hospital, people that work in different departments in the hospital, telling you about, breast screening, bowel screening, and all that sort of stuff. Yeah.
Which is really important to get out there as well. So, ladies, it's been fantastic having you on the show. I'm really excited for the event. I don't think anyone will forget the date, 14th of February. Mark it in your diaries, and not with a heart. Well, actually, with a heart.
With a heart.
You have to look after your heart.
Yeah. So be there or be square. So anything that's not you haven't picked up on the show, don't worry, I will try and get that onto the Facebook page of the show. But ladies, thank you so much for taking your time out this morning, and I hope being on air with me eased your nerves, because I know that you were a bag of nerves coming into the show. But it's been a pleasure talking to you all, and I've had a good insight into research myself, so I've no doubt listeners were able to take away something positive from the show and are looking forward to the event. Listeners, mark the date in your calendar and correct me if I'm wrong. 14th of February between 11 and 3, and there'll be many health representatives available for you to have any discussions with. Thank you for tuning in. Friday Blessings. You've been listening to Neelum on Mother's Planet, only on Inspire FM 105.1 FM. Stay safe, stay informed, and stay connected.
Thank you.
That was lovely.
Coming up next, Buzz Me Not.